Hi class, this is my week 8 reading response video. This week we've been reading and talking about actual healthcare access for the LGBTQ population. I specifically wanted to devote my reading response to the article by Obaidin Malaver and the select other people. It's the article about undergraduate medical education. So for the MPH program, we're expected to do what's called a community-based master's project, or CBUMP for short. And this is actually what I'm doing my CBUMP on, and I've actually come across this article organically, so I was actually very surprised to see it in our class content. Um, but yeah, healthcare access is such a wide range of factors when we say things like low healthcare access. It definitely has a lot more to do than just having, a PCP or actual healthcare insurance. Healthcare access, especially for the queer population, goes way beyond that. Something I never realized until starting to do my own research. But healthcare access is very limited for these queer populations in a lot of ways. And one way I've sort of picked out from this week's readings and also my research is the notion of cultural sensitivity training in medical education. Um, so back in 2010, the Institutes of Medicine, as we saw in the article, the first article, did a sort of study on healthcare access among these populations, and it found out that same-sex couples, same-sex women specifically, tended to have report less on having health insurance than heterosexual women. Of course, things have changed a lot in the last few years with the Affordable Care Act. But I wanted to highlight another group that's done a lot of work on this. It's called Lambda Legal. I can actually post the article on the discussion board, but Lambda Legal in 2010 did a national survey. They did just under 5,000 participants from all over the country. And it was actually quite remarkable because they found similar findings of the transgendered folk that they surveyed. Over half had explained that it has taken them so much time to find a doctor that they feel safe with, that they feel understands their specific healthcare needs. Lesbian, gay, and bisexual folks reported high numbers of things such as fearing discrimination, things such as making assumptions that the doctor won't know their specific needs or be able to help them. And even to share a more personal story, I myself, along with thousands of other people, I choose to take PrEP to protect myself from HIV. And my old doctor, who's been in the field for decades, who actually works alongside of my stepfather, who is an internist, had never heard of PrEP. And I wasn't surprised because the town that I grew up in is, it's very whitewashed. It's very straight. I guess in like a very rough sense, it's very straight. So I wasn't surprised to know that my doctor had never heard of PrEP, but my doctor actually sent me to an infectious disease doctor. Had explained that, oh, I don't do anything with HIV. You need to go to the infectious disease doctor. So, for me, it was sort of an experience that made me feel weird because I'm not diseased. I'm negative. I was negative at that point in time. And it just really sort of made me feel bad about myself because the doctor sort of didn't just say, hey, I don't know much about PrEP, let me look into it and let you know. it was more so like, oh, I don't deal with that. You need to go somewhere else. Well, long story short, I now go to an LGBT clinic, so PrEP is handed out like candy, which is great. But I think the moral of that story was that this is something that people still face today. People in rural areas, people in areas that, they're a very strict minority. And it's really not fair to folks to have to go to the doctor and fear being discriminated against. And so that's actually why I decided to pinpoint my reading response on this medical education piece, because after looking at the 5 local schools, Drexel, Temple, Jefferson, Penn, and PCOM, which is an allopathic program, the amount of content devoted to LGBTQ specific healthcare needs is very limited. After speaking with someone in the Drexel College of Medicine, and correct me if I'm wrong, if any of you are in the College of Medicine, of course, but from what I've gathered, there's only one singular seminar devoted to sexuality, devoted to this notion of sexual identity, sexual orientation, gender identity, and how these notions of identity are very important in determining how someone thinks about their healthcare needs. So my opinion, cultural sensitivity is something that they push on us in the MPH program. Makes sense. But I think medical education, and not just undergrad, but also MD programs, while they have diversity statements, while they have words like compassion and acceptance and diversity in their mission statements and vision statements and objectives, I think we're lacking specific content to prepare people to serve these communities. Of course, if you're going to be a doctor in a very rural area that might not have a high concentration of queer folks, one might not think it's important to them. But being that the queer spectrum composes 10% of the population, it's almost inevitable that a doctor is going to come into a situation where they need to sort of frame their appointment to the needs of the person. And that goes for straight people, that goes for gay people, that goes for bisexual, transgender, all sorts of people. While I respect the idea of the Mozoni Center and other LGBT specific places, being a patient of one of those places myself, I always question, why do we have to have those? Why isn't every hospital, equipped to serve a gay man, serve a transgendered person? I'm not going to be a doctor. I think a lot of my opinions are probably sort of at risk of being critiqued by people in the programs, but I wanted to frame my response on this piece because I think it starts with education. We live in a very diverse melting pot country, so we do have people being prepared to serve women, being prepared to serve African Americans, immigrants, all these, vulnerable populations, but we lack the sense of teaching people about sexuality and how that has to do with someone's frame of mind and their specific health needs or even their specific health risks. I think 10% of the population is big enough to say that we do need to revitalize some of the ways we teach our doctors, because as MPH folks, as public health folks, we have a very population health focus, and I understand that that's not the same as being a doctor because you are dealing with one patient at a time. But I think when, if a doctor is equipped to know these sort of population health, contributing factors, what are some factors that contribute to high risk for HIV transmission, risky behaviors, what is the effect that discrimination has on people. People feel socially isolated because they feel they can't go to the doctor without being discriminated against. It's not just the work of nurses. It's not just the work of public health folks. And, I'm not saying that all doctors aren't sensitive, but I think we need to get at the root cause of why people feel that they can't serve this population adequately, and that starts with education. So, Dr. Sell, I wanted to thank you for sharing this specific article because after I found it doing my C-bump work, I found it very interesting. I never thought that doctors, that medical education was lacking in certain ways. I tried to go to medical school, I didn't get in, which is fine, but I had never realized that education was a key component of this, and I think it's really important that as myself entering the career, I'm definitely going to try and focus on some of these root causes because um, public health folks and nurses, I give a lot of credit to nurses too. We're not the only ones that should have to be practicing distinct cultural sensitivity in our education. I think doctors, I think doctors should have to practice that, and that comes down to the licensing boards. That comes down to the medical examination boards, the LCME standards. So, I mean, it's a very complicated thing. It's not going to change anytime soon, but when we talk about healthcare access, one of the key components for queer populations is discrimination and the amount of bullshit that people deal with on a daily life. So that's what I wanted to talk about today. It's a little long. Looking forward to reading your guys' papers next week. Have a great weekend. Thank you.